Hello, everyone, and welcome to the fourth and final installment of the Molecular Epidemiology webinar series. My name is Steffany Cavallo. I am an epidemiologist in Tennessee. I'm going to be starting out the webinar today, but we have a series of speakers who will be talking and sharing their experiences. If you have questions, everyone on the line is actually muted, and so if you have questions, we ask that you ask them in the Q&A box. There's a button on your screen that you can ask a question in, and we will address all those questions at the end of the webinar. So today we're going to be covering case studies on the use of whole genome sequencing in foodborne disease surveillance and outbreak investigations. And like I said before, this is the fourth and final installment of the webinar series. And these webinars, the previous three, have been recorded and are posted on the New York State's Food Safety Center of Excellence website. And you can access them there if you missed any or if you wanted to listen to it again. There are also some training modules on the COE website that go into more depth on some epidemiology, genetic epidemiology topics, including Genetics 101 and more advanced topics on tree building. As part of the core activity of the Integrated Food Safety Centers of Excellence, we're asked to train other public health staff, and so this is how this webinar series came to be. And so today we're going to focus mostly on the application of whole genome sequencing and how we've used it here in Tennessee, and then I'll pass it on to Carlota Medus in Minnesota to talk about the Minnesota experience, and then finally Matt Wise from CDC will talk about some use in multi-state investigations. So just a little bit on Tennessee. We have a population of 6.6 million, and our health department structure is largely regionalized, and so is our public health laboratories. We have 3 public health laboratories. 2 of them are state health laboratories, and 1 is a county laboratory, but all of our sequencing activities occur at our main Nashville laboratory. We began whole genome sequencing in December of 2014 with Listeria. At this point, we have 5 Illumina MiSeq sequencing instruments and an additional 1 on the way, so we'll have a total of 6. And right now we have 4 laboratorians certified and 2 additional who are being trained. So we'll have a total of 6 instruments and 6 laboratorians who can use them. So currently the process in Tennessee is that we receive a specimen at the public health lab or an isolate, and we perform the sequencing on that isolate, and then right now, we're just doing sequencing. We do not have in-house capacity to do any analysis of those sequences, so we're either sending it to the New York State Wadsworth laboratories or we send it to CDC for analysis. Right now, New York State does all of our Salmonella Enteritidis, and all of the examples that I'm going to share today from Tennessee are Salmonella Enteritidis, so they're all sequences that were analyzed by New York State Wadsworth laboratories. Currently, in real time, we are sequencing Listeria, E. coli, non-0157, and Salmonella. We're about 300 isolates behind being in real time for Salmonella. And we do sequence other pathogens upon request or for special projects. So for Salmonella, if we have a suspect outbreak, since we are a little behind, we will push those to the front of the line. And we plan to add some other pathogens to our sequencing roster. Before I get talking about some examples of use of whole genome sequencing in Tennessee, I thought I would talk a little bit about our structure and how our epidemiologists and laboratory communicate. And so many years ago, Tennessee created a position which we call our Epi Lab Liaison. And this is an epidemiologist by training whose main role is to improve and enhance communication between the EPIs and the laboratory staff. So they're the main point of contact between EPIs and the laboratorians. And they do a weekly site visit to the public health lab, not only to maintain relationships, but also to create our PFGE cluster report. And I know this is a little bit unique to Tennessee. This epidemiologist has access to bionumerics, and in a lot of states, I know the laboratorians are the ones that create your cluster reports, but we do it this way in Tennessee. And it's helpful for us to have someone with the EPI in mind creating these reports and consulting with the laboratorians. So this same Epi Lab Liaison also is the person that identifies the clusters and then assigns them to an epidemiologist for follow-up. And so with that structure in mind, we decided when we started to implement whole genome sequencing that this person would be our point person for helping to prioritize which specimens are getting sequenced and then analyzed, and coordinating the analysis getting done, since we do not do it in-house. And then they're also the person that's getting a lot of the data back, and the trees and the heat maps. And so they're the person that sort of is leading and interpreting those results in consultation with laboratorians from New York State CDC and our own public health lab. So today I'm going to talk about 3 examples in Tennessee, and the first one is just a retrospective analysis of some of our Salmonella enteritidis data. This is one of the first sequencing projects that we undertook in the foodborne world here. And then the next 2 examples are outbreaks. The first one is a point source outbreak where we used whole genome sequencing to verify the epi information that we collected. And then the second outbreak is where we kind of use whole genome sequencing, or whole genome sequencing was used to actually find this outbreak that we may not have found otherwise. So first, this retrospective analysis, we sequenced all of our 2014 Salmonella enteritidis pattern 4 and 5 data. And in Tennessee, as in many places, these are some of the most common Salmonella enteritidis PFGE patterns. And so we see a lot of this. It's very difficult to tell if our isolates are part of an outbreak or if they're just part of our background rates. And so you can see in the image on the screen, if we were looking at these just with PFGE, we would have had, for these well over 100 isolates, just 2 giant clusters to try to investigate. And so when we sequenced them, these isolates broke down into 16 distinct clusters, and we defined a cluster as any group of cases that had less than 5 SNP differences. And so in looking at this information, we felt pretty strongly that we potentially are missing some outbreaks that we, without having a technology that can give us additional resolution, like whole genome sequencing. So we're also gonna do this with some of our Salmonella Newport, our really common Salmonella Newport patterns, and kind of see what the diversity is among those PFGE patterns. So for our second example, this is a point source outbreak. And so this is our standard PFGE cluster report. I'm just gonna orient you. So each line is a isolate or a person. And on the left, you can see the PFGE bands, and then we have some basic demographic information for each case. And so we always have a ton in the summer, a ton of Salmonella enteritidis pattern 4, but on this particular week, we noticed some clustering in time and space. In geography, these cases are mostly in Middle Tennessee, and they were all isolated pretty close to one another. So we decided to investigate them a little further. And so we did find an epi-link. 6 of the 7 of those cases on the previous screen ate at the same restaurant on the same day, and they were part of 4 different parties. So it was a pretty clear point source outbreak. We did an analytic study, and we implicated a hanger steak dish that was served with a béarnaise sauce made with raw eggs. We traced the eggs back to a farm, and it was pretty open and shut outbreak investigation. We sent the specimens from this outbreak for whole genome sequencing, and they were all within 0 to 1 SNP. So they were very, very closely related. And they were also over 30 SNPs different from all of the isolates that we had previously sequenced for Salmonella enteritidis pattern 4. So we felt like this was a very distinct outbreak, and the whole genome sequencing supported the epi. The issue we had at this point, however, was that we knew the eggs were still being distributed throughout 2 counties in the state. And we thought cases could potentially still be occurring, and we wanted to be able to find them. So we at the time didn't have the capacity to sequence all of our Salmonella enteritidis pattern 4. So in order to sort of prioritize which isolates we sequenced, we did some case-based surveillance for the rest of the summer to look for additional cases that had similar age, geography, or eating patterns. And we did find another cluster of illness. We found 8 people who, among those cases, who ate at a separate restaurant. This restaurant makes some raw egg mayonnaise that they put on a lot of their sandwiches. And so there was a clear suspicious food item. And this restaurant also sources their eggs from the same farm. And so we sent these also for whole genome sequencing. I'll share the sequencing results in just a moment. But they all were very closely related to the original outbreak also. So just to show overall the cases for this outbreak, we had a point source outbreak you can see in May, which we identified without whole genome sequencing with our own surveillance. But these other cases that occurred throughout the summer were pretty sporadic, and While we did find them mostly with case-based surveillance, the verifying with whole genome sequencing that they were actually linked to this original outbreak was really important to us. And so you can see here a heat map with all 15 of the confirmed cases that we had in this outbreak. And the restaurant A and B cases are on this heat map. And you can see they're all within 0 to 3 SNPs of one another. And just viewed in a different way, here is the phylogenetic tree or the dendrogram. And all cases are within 0 SNP, or within 3 SNPs of one another. And most of them were actually 0 SNPs different. So highly related. I also wanted to mention that 2 of the cases in this outbreak actually ended up being a different PFGE pattern. They initially looked like pattern 4, and then they were called pattern 0163. So we might not have pulled them into this outbreak investigation if we had not already sent them for whole genome sequencing. And for our final example, this is again, so the previous outbreak, we used whole genome sequencing to sort of verify and support the epi information we'd already collected. In this third example, we were working sort of in the reverse direction. So once again, we identified an increase in SE pattern 4 isolates on our weekly PFGE report, which you see here. In this case, they were all located in a single county in the state. And we started to look at the case report forms, and there wasn't really anything that was popping out. So we had simultaneously sent them for whole genome sequencing, and when we got those results back, we found that actually most of them weren't related, but 3 of them were highly related. They were within 0 SNPs of one another. And we got the information back from New York State. They also provided some interesting information, which was that in addition to the 2017 isolates being 0 SNPs apart, they were also within 3 SNPs of 6 isolates from 2015 and 2016. So isolates from 1 to 2 years ago, they're really closely related to. At this point, we hadn't had a lot of experience with this, and so we actually asked CDC, would you investigate something like this, that, they're within 3 SNPs, but they're, 2, almost 3 years apart in some cases. And they said, absolutely, we should investigate it as one outbreak, or as one cluster, and so we did. And we went back and re-interviewed a bunch of the cases from 2015 all the way through 2017, and we did identify an epi-link. 6 of 9 actually reported eating at the same restaurant in Memphis, Tennessee. We were not able to narrow it to a food item, but we were able to identify some problems in the restaurant. There was many opportunities for cross-contamination, and we were able to address those deficiencies. So there was some public health action that was able to be taken. But at this point, this outbreak still has a somewhat unknown source. We have some suspicions about maybe some locally sourced products and potentially environmental contamination of the restaurant. But we did take some swabs of the restaurant, and they were all negative. So we wouldn't have found this without whole genome sequencing. And we were able to take some public health action with the investigation that we were able to do. So just to conclude for Tennessee, we have so far found whole genome sequencing to be very, very helpful in our investigations. We've mostly been using it for sort of reducing the white noise surrounding our most common PFGE patterns. It also was really helpful for that second example, the outbreak with associated with eggs, to kind of support that challenging hypothesis that people could have eaten an egg product that they don't recall. So it was really helpful to have the whole genome sequencing data supporting the fact that they ate something with raw eggs in it. We also have found it very useful to have an epi-lab liaison. I don't know how many other states have this, or if we're the only one, but it's helpful to have someone who's talking to the lab every day and can ask the questions we need to ask. They also, this person on our staff has extra large computer monitors, which is very helpful when we're getting back very large dendrograms from New York State. As an example, the image in the right-hand corner of the screen is what our current Salmonella enteritidis pattern 4 dendrogram looks like. It's gotten very, very big because it has all of our isolates in it. As you know, with high-quality SNP analysis, we're comparing every isolate to each other. And so as we continue to sequence, we just are comparing all of those sequences to each other. So these dendrograms get pretty big, and so sometimes it's a little challenging to look at. And obviously, some of our challenges I think I alluded to, we can't analyze the data in-house. So, we are relying on CDC and New York State right now to do the analysis for us. This obviously might be something that changes as we move towards implementation of whole genome MLST through bionumerics. But our current process is challenged by that, and not just the analysis adds time to our timeline, but also the sequencing itself. The sequencing takes a little bit longer than PFGE we've found, and you have to rerun things sometimes. So it definitely adds some time to an investigation that wasn't there previously, but it provides a lot of really helpful data. And as I mentioned, a lot of these challenges might be addressed with whole genome sequencing MLST, as we won't necessarily be getting dendrograms like this when that's implemented, is my understanding. So that is all I have for Tennessee, and I'm going to pass it over to Carlota.
Good afternoon. I'm just trying to get my slides right now. So give me 1 second. Okay. Oh, that's not the ones I want to share. I was not sharing. Okay. Thank you. All right. On this part of the webinar, I will be showing the Minnesota experience using whole genome sequencing as part of routine surveillance. I will compare the utility of whole genome sequencing and PFGE in surveillance using 2017 Salmonella Enteritidis data as an example. And I will show some outbreak examples using whole genome sequencing. We started using whole genome sequencing for Salmonella Enteritidis surveillance and cluster detection in Minnesota in 2014. This year, we started using whole genome sequencing for Salmonella typhimurium surveillance as well. Just like Steffany from Tennessee just described, our SC and typhimurium isolates get sequenced here at the Minnesota Department of Health, and high-quality SNP analysis is done at Wadsworth Center, the New York State Department of Health. Additionally, we are sequencing all other Salmonella isolates and STEX, but those are only analyzed on request. So for example, if we are investigating an outbreak or a cluster and we want greater discrimination, then we'll request it. We're also doing all Listeria isolates, and those are analyzed at CDC. And we have not given up on PFGE. We're still using PFGE as part of our surveillance activities. An essential element of conducting surveillance is how the epidemiologists obtain data from their laboratory. But before we can even talk about communication, we actually had to sit down and decide who would take responsibility for identifying clusters. So the laboratory and EPIs got together, and we jointly decided that it made the most sense for the laboratory to interpret the data, identify clusters, communicate those clusters to epidemiologists, just like we do with PFGE. So unlike Tennessee, we don't have a liaison. We communicate directly with our laboratorians. And they also provide the sequencing data to the EPIs in case we want to look at it, like the trees and the heat maps and such. Now, we, the epidemiologists, also share information with the laboratory. So it's not a one-way street. We actually share information back about what we're seeing. You know, do we need to make any changes or anything interesting that comes up? We also had to jointly decide what to call a cluster, and I'll describe that a little bit further in a minute. So the previous webinars described at length what a high-quality SNP tree looks like and what it is and how to interpret it and heat maps. So I won't really talk about those here at all. But let me show you some other simple ways that our lab communicates with us, the EPIs in Minnesota. Instead of always looking at the trees and the heat maps, the epidemiologists will actually look at the spreadsheet that the laboratory created. It is pretty straightforward and it's super helpful. It includes the lab ID, the Minnesota pattern name, a PFGE pattern, the number of SNPs to the closest isolate in the tree, and the lab ID for all the closely related isolates. And we also have a cluster ID, which is actually something that we added just with whole genome sequencing. Prior to this, just with PFGE, we never actually used a cluster ID for our investigations, and we started with sequencing. But this is actually what we rely on the most. Just an email from the lab telling us if we have a cluster. I'm going to zoom in a little bit. Here it is. So in the email, every time there's a new cluster or new isolates that are added to a cluster, we'll get information like the cluster ID, the number of SNPs from each other, the lab ID for all the isolates in the cluster, and this is the Minnesota pattern name. This is 2 enzyme pattern name. Note that in this cluster, cluster 13, there's 2 different PFG patterns. So how did we decide what to call a cluster? So we know that we're looking at degrees of relatedness with whole genome sequencing. It's a continuum. It's not black and white, this matches or doesn't match. So it's a lot of, it's a continuum. So but for identifying clusters prospectively, we needed to decide how closely related isolates had to be for us to look at them and take the time to investigate them. So we used the data. We did a retrospective study a couple of years ago where the laboratory sequenced clinical isolates from distinct, well-characterized foodborne outbreaks and isolates from sporadic cases back to 2000. In this analysis, all the isolates within each outbreak were 0 to 3 SNPs from each other, and they were very different from non-outbreak isolates. They were on average about 42 SNPs apart. So we decided that the lab will notify us of everything within 5 SNPs. So that's what we're calling a cluster. But we also know that once we start an investigation that we may need to expand, we may need to include things that are less closely related, or we may need to narrow our definition depending on the epi data. So this slide shows the clusters that we've seen in surveillance in January through April of this year, 2017. On this side, we have the PFG clusters. And for this slide in particular, we're using a very loose definition of a PFG cluster. So basically any 2 isolates that match by PFG in the entire January through April period. So it doesn't really have a real-time component. So in this time period, we had 5 PFG clusters ranging from 4 to 30 cases. They're in the order of how common this PFG pattern is in Minnesota. So pattern 4 is the most common, pattern 2 the second most common. So for those 2 patterns, you can see that these are ginormous, like, clusters. They're not really clusters, there are a lot of isolates. Then at the other end, pattern 49 is extremely rare, so that we had 7 cases was a bit concerning. Now look at the whole genome sequencing cluster side of the slide. We had 13 clusters, and if you're looking closely, we're missing cluster 8. That was just a little glitch in our numbering system. But we had a lot more clusters, obviously, and the number of cases per cluster was much smaller, ranging from 2 cases to 12 cases in each cluster. Also note that cluster 11 had 2 different PFG patterns. So this is the high-quality SNP tree showing all the isolates analyzed in the last 90 days, but this is from late April. Includes every isolate that's closely related within 10 SNPs back to what we call the beginning of time, which for us in whole genome sequencing is 2014. And I know this is really hard to see, so I'm going to focus on the top part. So these are all the clusters that we saw in that time period for that part of the tree. And the way that new isolates get inserted into the tree is based on how closely related are to other things that are in the tree. And that's why the clusters are not numbered sequentially from top to bottom. They're just cluster 2 is in the middle of the page and 9 is on top of the page. Now, cluster 5 involved, all the cases in cluster 5 traveled to Jamaica, and they all actually stayed at the exact same resort. Cluster 4 was a restaurant-associated outbreak, and actually, I will not talk about that outbreak in this presentation just for lack of time. Now, looking at the bottom half of that same tree, these are all the clusters in that time period. The top 2 clusters were travelers to Mexico, and within each cluster, all the cases stayed at the exact same resort, but different resort from the other cluster. All of the bottom clusters and the related isolates from previous years were travelers to the Dominican Republic. Within each cluster, people stayed at the exact same resort and different resorts from the other clusters, except for cluster 1, which actually 3 different resorts were represented in that cluster, but they were all geographically very close to each other. So for all the travelers, these clusters that we're looking at represented probably real outbreaks in other places. So now I'm going to shift gears a little bit and compare PFG versus whole genome sequencing, what we see. Now remember that I said that we're using whole genome sequencing for cluster detection. So we're not waiting for PFG and then ask for whole genome sequencing data on those matches. These 2 efforts are happening in parallel. We're getting PFG data, and separately, we're getting whole genome sequencing data. So clusters could be identified with either or both. But just for comparison purposes, I will show them together. So these are all the pattern 4 cases. Each box represents a case or an isolate from the beginning of this year till the end of April on the specimen collection, week of specimen collection date. And the ones without dots are the same second enzyme, so they're pattern 4 and pattern 2. The ones with dots had a different BLN. So even adding BLN, we had a little bit more discrimination, but not a ton of discrimination. We still have this giant cluster that is really very difficult to tell if anything's going on. So these are the same cases. When you add whole genome sequencing, it really kind of separates them out. All the white ones are unrelated to each other and to anything else. The red ones were actually an outbreak associated with eating kitfo, which is an Ethiopian food. And the ground beef that was used to make that kitfo was purchased at the same retailer. The pink ones are the Jamaican travelers that I already mentioned. And the yellow ones are a cluster that was unsolved. And actually is the only unsolved outbreak that we had, the only unsolved cluster that we had this year using whole genome sequencing for SE. This is a high quality SNP tree, just showing the pattern 4 cases. And you can see that it separates them out, the 3 clusters, quite nicely. And actually, when you look at the number of SNPs difference from the Ethiopian food, the kitfo cluster, to the most closely related isolate, the difference is 46 SNPs. So we have 0 to 3 and compared to like 46 from that one. So they're quite different from each other. All right, now let's go back to the tree and let's look at cluster 9. Cluster 9 was looking at PFG pattern 49 is really rare in Minnesota. So when you look at the cases, we had 1 lone case here in January and then a number of cases in April. And even though there is a huge time period between that first January case and the April cases, because it was a rare PFG, we looked at those together as we normally would if we had a rare anything, a rare serotype PFG. So when you look at that pattern of cases spread out over time like that, the things that come to mind are things like foods that are shelf stable, or frozen foods, or there's a big gap in the middle. So from the epi perspective, you probably think, well, could that be a restaurant outbreak where now there's an environmental reservoir and something led to more cases? So the kind of questions that you ask will take into account that big gap in time. When we use whole genome sequencing, that first case dropped out. It was 18 SNPs difference. So it was no longer part of the outbreak. And it turns out the other cases were all part of a multi-state outbreak associated with leafy greens. And at the time that we stopped, and by April 30, that was still it was still an ongoing investigation, but now it is pretty much concluded. And we ended up with 10 Minnesota cases that all were 0 SNPs from each other and 149 cases nationwide. So of the 13 whole genome sequencing clusters that I mentioned, 4 were not travel associated, and the 3 of the 4 were solved. So the examples I just showed you from surveillance described here showed how whole genome sequencing helped us refine the case definition, excluded cases that were not part of the outbreak. It cleaned up a common PFG pattern, pattern 4, and basically split it into multiple outbreaks. And the travelers were likely all real outbreaks, given that all the cases within each cluster stayed at the exact same resort. Now I'm going to go back in time a little bit, 2015, and I can never give a talk without talking about stuffed chicken. It seems like I always have to talk about this. So I'm going to use the stuffed chicken example. And the short version of this outbreak is that we identified 3 cases of surveillance they were SE pattern 5 and pattern 37, 2 enzyme pattern combination. By whole genome sequencing, they're 0 to 1 SNP different. So they were very closely related in May and June of 2015. All 3 reported eating exactly the same brand of stuffed chicken products. Products were collected from retail by the Minnesota Department of Agriculture, and a lot of testing was conducted. And 83% of the products that they tested were positive for salmonella, including 5 salmonella serotypes and 4 PFG patterns of SC, including pattern 4 and second enzyme pattern 2, but not pattern 5 or pattern 37. All the food isolates were sequenced, and we didn't find any food isolates that were closely related to these 3 cases. Later in July, we had 2 cases that were pattern 4, second enzyme pattern 2, and there were actually 0 SNPs from the product isolates that we had identified during the first part of the investigation. On interview, those cases also reported eating the same product. So in essence, whole genome sequencing of the food isolates help us rapidly identify the 2 additional cases that were part of this polyclonal outbreak. But this is not really the whole story. This is a very simple way of looking at it. This is really what was happening. So in this slide, all the light blue and the dark blue boxes are cases whose isolates were pattern 5 and second enzyme pattern 37. And the dark gray boxes and the teal boxes were all pattern 4 and second enzyme pattern 2. So the cases in this outbreak occurred in the midst of a lot of cases that match by PFG. So using PFG alone, it would have been very difficult to prove that this really was an outbreak associated with this product. So the stuffed chicken product example from 2015 shows that product testing helped identify additional cases that did not match the initial outbreak cases by PFG or whole genome sequencing. And whole genome sequencing identified this really small polyclonal outbreak, even though there were a lot of PFG matching cases at the same time. So I'm going to turn this over now to Matt Weiss from CDC. Matt?
Yep, thanks, Carlota. I'm just sharing my screen. And can you see my slides?
Yes, we can, Matt.
Okay, great. So I'm going to talk a little bit about how sequencing is played out in the multi-state investigation context. So, we've talked a lot over the last several years, even I think, as whole genome sequencing has been implemented, about different ways that sequencing was going to affect the outbreak investigations that we all work on together. And I think Steffany and Carlota both, provided, some really concrete examples of how we were seeing sequencing break common PFG patterns into smaller, maybe more solvable clusters, or to at least refine sort of outbreak case definitions where we can exclude illnesses that are sort of unlikely to be related to actually a common source. So I wanted to spend a little bit more time on a couple of these other ways that we have seen sequencing play out in some multi-state investigations. So I'll walk through a couple really brief examples of these other ways that sequencing has sort of played out. So the first cluster I wanted to talk about was the cluster of STEC0121 infections that were linked to flour in 2016. So the main outbreak PFGE pattern combination for that cluster was a 1/1 pattern, but we found in that investigation that there was one ill person that actually had two different O121 pattern combinations from isolates. And so they had that main outbreak pattern, but they had a second pattern combination that shared one of the enzymes with that main pattern. And so we thought, well, maybe we should do, a little bit of additional case finding to see whether maybe other PFGE patterns are involved in the outbreak, maybe either as a polyclonal outbreak or other patterns that are actually closely related to this main pattern by sequencing. And so what we did in that was we requested sequencing for any other STEC O121 isolates during that time period that had the same first or second enzyme. So essentially to do a little bit of additional enhanced case finding. And so it turned out we identified a number of isolates during the outbreak period that shared either the first or second enzyme with that main outbreak pattern combination. And so this is the tree that we put together. So you can see the main outbreak clade is the group of isolates that are 0 to 3 SNPs from one another. You can see in the red boxes, there are isolates that came actually out of flower samples. And then the other boxes are actually clinical isolates. And I've color-coded here the other PFGE pattern combinations that ended up getting rolled into the investigation on the basis of this additional sort of case finding. And so we ended up actually rolling several other PFGE pattern combinations that fell into that main WGS clade into the outbreak investigation. And so I think this helps for a couple of reasons. I think one, especially when we have a smaller outbreak investigation, it may sort of help increase the number of potential people that can be interviewed to get epi data. So I think that's really useful, I think, in these investigations. I think the other issue that this brings up is it's often, I think, a little bit counterintuitive when we talk about implementing sort of a more specific technique like whole genome sequencing that's sort of bringing together isolates that were actually differentiated by PFGE. And I think it's important to remember that a lot of the whole genome sequence analyses that are conducted actually exclude mobile genetic elements that may appear as additional bands or things like that on a PFGE gel, but when they're actually looked at by sequencing, they're highly related. So I thought the flower outbreak was a great example, I think, of us sort of pulling different isolates together or isolates with different PFGE patterns together into one investigation. Another thing that we've found is that sequencing sometimes demonstrates that there are PFGE identified or defined clusters that are just not really outbreaks at all. And I think this can be really helpful to sort of save time and resources for those clusters that may actually not be something real. And so back in 2016, there was a cluster of Salmonella typhimurium infections with a pretty uncommon PFGE pattern. So we had a reasonable suspicion that these were related to one another, to a common source. There was geographic clustering in the southwestern United States. We were seeing pretty high morbidity and mortality for a Salmonella outbreak, unusual specimen sources. Most of the ill people reported were Latino, and a lot of them were reporting underlying illnesses. And so it seemed like there was something to this one, and we were certainly concerned because of the severity.
Hey, Matt, this is Martin.
Yes.
You're on presenter mode. Any chance that you can get the full screen?
Oh, I'm sorry. Yeah, sure.
Sometimes the issue is that you have two screens.
I do have two screens. I'm sorry. Let me try that again.
Yeah, you still.
Here, I'm going to switch them for you. 1 sec.
Okay.
How's that?
Okay. Now.
Did that do it for you?
No, now at least for me, it runs off this screen. It's.
Okay, here, let me try this one more time.
Yeah, try it one more time, otherwise we can stay with the other one.
Okay, sorry about that.
No problem.
Same or different?
Same, you're still on presenter mode. Let's stick with it. I think it might be a little bit more tricky.
Okay, sorry about that.
No worries.
So in this investigation, folks ended up actually conducting open-ended interviews to look at these ill people and actually didn't really find any common epi connections between them in terms of food exposures. And we also actually kind of assessed medical exposures because there were so many underlying illnesses reported. And this is the whole genome sequence tree that we actually saw in this outbreak investigation. So it actually turned out that there were a few sort of one-off, two-off instances of isolates that were, related to one another, but this cluster as a whole really didn't hang together by whole genome sequencing at all. And as it turned out, when there was more sort of epi data collected, this high sort of illness severity, sort of fell apart, and it really looked like it wasn't much of a cluster altogether. But it was one of those ones where I think we really saved time and resources, because it said to us like, hey, this thing that looks scary may actually not be a thing, and maybe it was just sort of a statistical sort of blip. One of the other things I wanted to talk a little bit about was identifying outbreaks following product testing, and I think Carlota alluded to this a little bit around some of the data that was useful from product testing for the stuffed chicken products. But I think there are really some investigations where the outbreak would not have been identified, at all, I think, without the results of product testing. And I think a great example of that is the Bluebell ice cream outbreak in 2015. And so this one was really kicked off on the basis of some routine product sampling that was conducted by South Carolina in 2015, and they identified 7 different PFGE patterns of listeria from the ice cream that they tested. Some of them were pretty rare, but several of them were actually quite common PFGE patterns. And so when we looked in PulseNet, we found that there were a ton of clinical isolates that matched these patterns from ice cream, and there were also other foods and environmental isolates that were found that also matched those patterns. And so it was a little bit unclear whether the listeria in this ice cream really was linked to any human illness at all. And so when we were able to look at the whole genome sequence tree for this, there ended up, again, being these multiple patterns in ice cream. Those are indicated in blue on this whole genome MLST tree. They're all actually closely related to one another, also closely related to isolates from patients that were being investigated in a Kansas hospital around the same time period. And so these 4 Kansas patients are closely related to those ice cream isolates. And it turned out that that hospital actually was using ice cream from this company to make milkshakes at that facility. And of course, this led to a broader investigation that actually ended up implicating another production facility, but again was a really good example of that product testing combined with the sequencing tipping us off to identify a linkage of illnesses to an outbreak. And then the last thing I wanted to mention was sort of thinking about sequencing in terms of helping us understand the ecology of pathogen reservoirs. And one investigation I think where this played out was a multi-state listeria outbreak linked to soft cheese back in 2015. And this was predominantly in California, but had cases in other states. And there was an early signal in this investigation for foods bought at Middle Eastern stores and soft cheeses. We saw multiple different PFGE patterns, both in clinical isolates at the time, but also environmental isolates that were uploaded to PulseNet. The other thing we saw is that these isolates actually spanned quite a long time period, about a 6-year time period from 2010 to 2015. So this is the whole genome sequence tree for that investigation, and I've kind of color-coded the PFGE pattern combinations in this tree, and you can see that despite the fact that we had a ton of different PFGE pattern combinations, they actually all fell together within 26 alleles in the whole genome sequence tree. But you can also see that they were related to environmental isolates that also occurred over a relatively long time period, both 2010 and 2015. And so we had environmental isolates collected 5 years apart or 6 years apart from one another that were closely related to clinical isolates that spanned this full 6-year period. And so really was good evidence that there was some sort of resident issue in this production facility that had persisted for a long time period. It wasn't sort of introductions of different listeria over time. And so I think really helped people in the outbreak think about the cause and how a pathogen might have resided in that environment for such a long time. So the concluding last little thoughts I would just have about this is, interpreting sequencing data really can be complex. And I think as Carlota alluded to, relatedness is assessed on a continuous scale, and that really opens up a lot of potential gray areas in our investigations and a need to make some judgment calls based on the data that we have. And so I know at CDC and I'm sure in states and local health departments, we really rely on a lot of expertise from our laboratory colleagues to sort through what all of that means. And I think in particular, making sure that we pair the epidemiologic data we have with that subtyping data can be really important. And knowing that it's a zoonotic outbreak or knowing that it's an outbreak with a certain serotype helps us think about what kind of SNP differences or allele differences to interpret as relevant. But I'd say despite all this complexity that we're still sort of working through, sequencing has in very concrete ways improved our ability to detect outbreaks, to triage how important they are, to investigate them, and essentially solve more foodborne and zoonotic outbreaks. And so I think as we expand the routine use of sequencing, not just for multi-state outbreaks, but to localized outbreaks, we're going to find a lot more investigations. I think you saw evidence of that in the talks that Carlota and Steffany gave. But some of these are going to be smaller and actually more solvable. And I think so there's I think a good opportunity there for us to really get to the bottom of a lot of illness that was really probably not solvable in the past. So I think that's all I have. And I think, Carlota, I'm passing back to you.
Yes, I have only like 3 more slides. Let me get them up here. Oops, hold on. All right, I'm assuming you can see them. I sure hope so. So there are a lot of unknowns still. We're still implementing this, and a lot of states or laboratories have not started working with the epi yet, and yet EPIs haven't necessarily started using whole genome sequencing. So that makes us all a little uncomfortable. Even questions like what should we consider a cluster for other salmonella serotypes or for other pathogens, or if we're even using a different reference genome, things change. So that's a big question. How closely related do case isolates have to be for us to investigate a most possible outbreak? So we need to learn to be a little bit more flexible to be able to deal with that level of uncertainty, because in reality, the context will be a lot more certainty than uncertainty. So it's a little bit a different context that we're used to, that we'll just have to get used to. And how does lab and epi communicate? That was really important when we started using whole genome sequencing prospectively. One thing is to do a study and a retrospective study. What are we going to look at? You meet once, you talk about it, you do it. But prospectively, it's really important that you have a clear plan. So if you haven't done so already, I would strongly suggest that lab and epi for your jurisdiction meet and at least discuss a plan and be flexible, because sometimes when you implement the plan, things don't go as you thought they would go. So again, it's important that you're flexible. We're going to see a lot of things in the near future, and how you define near can vary, but we should at some point be able to use bionumerics to more easily analyze our sequencing data at the state level, and that will be really great. We've all heard that whole genome MLSD is the wave of the future. That's what we're going to be using, and that will allow us to have a naming system, which will make it easier to communicate. But that doesn't mean that we won't be using SNP analysis. We may need greater resolution at times. Again, we'll have to look at the epi data and the lab data and be flexible and communicate. And we've been really focused on cluster detection and outbreak investigations, but the use of whole genome sequencing goes way beyond cluster detection. For example, our laboratory is going to start using whole genome sequencing for salmonella serotyping probably at the end of next month or in the near future. It can also be used to identify all the astic virulence factors or the presence of antimicrobial resistance genes. So this will really change how we do things. And like Matt said, everything that we'll do will have kind of a much stronger sense of real. This is a certainty. This is really what we're looking at. Is really important that we follow through with clusters and such. So as we move forward in implementing whole genome sequencing across the board, if your jurisdiction needs help with either training or discussing anything specific for your state, helping with lab epi communication, or if you have questions in a given cluster investigation that you just want to either ask somebody or just bounce off your thoughts with somebody, do reach out to your regional center of excellence. And if we can't help you directly, we will actually figure out somebody that can help you. So let's go to questions. And I know there's some already. So let me stop sharing and pull up questions. All right, so the first question is for Tennessee. So Steffany, I'll let you answer that one from Ginny.
Okay, so the question says, when Tennessee re-interviewed cases from 2015, the restaurant outbreak identified through whole genome sequencing, how well were cases able to recall? That's a great question. It was a mixed bag. So we had 6 out of 9 who were able to verify that restaurant for. There was, I think, at least one case that had reported that restaurant on their first questionnaire. And so we had, as we were interviewing people, we were kind of building a restaurant-based questionnaire that we asked of everyone. And so because for the really old cases, we kind of asked them, do you definitely recall eating here? could you have possibly eaten here? Have you ever eaten here in your life? Because it was actually kind of a nice restaurant, so a lot of people did recall eating there. And we did look out because a few of the older cases had some significant sort of life events around the time that they became sick and that they had eaten there, and so they were able to recall eating at that restaurant. But again, for some, we just weren't able to get there, and we think it probably was because of the time lapse. So I'll go ahead and read the next question. For Minnesota, you include cases in clusters if they are within 5 SNPs. Is there overlap in clusters, like a case will fall within more than one cluster?
Well, before I answer the question, I want to say that I brought Angie Taylor into the room. She is our whole genome sequencing guru and the person that fields all my questions all the time, every day. So in case there are more lab-related questions, she can actually help me. But to answer this question, we actually don't see that much overlap when we made the cut point at 5 SNPs. In the very early effort, part of the effort in 2014, we initially had picked a 10 SNP cut point for clusters, and we did have a ton of overlap. Plus, we were looking at a lot of things that were obviously not related. But once we actually narrowed it down, which didn't take very long for us to make that decision, to 5 SNPs, we don't really see any overlap. The next question is also from Jenny from Minnesota, and it says, do you use the 5 SNP definition for all pathogens? Now that you are performing whole genome sequencing for typhimuriums, are you noticing that the 5 SNP cluster grouping is best, or do you think you might change? Are you thinking that you might revisit that? And the question is, no, we don't know that the 5 SNP definition will apply to all pathogens. That is one of the big unknowns. For typhimurium, we are now also doing a retrospective study that will actually help us fine-tune the cut point. We are thinking that the 5 SNP cut point might work for many typhimuriums, but maybe not for, is it pattern 1314? CDC, I think that's super common. We may need to use a different reference genome, or we may need to use a different cut point. So we're still playing with that. So yeah, we think we will change, and we do need to revisit. That's one of the tricky parts of whole genome sequencing, is that we will have to actually adjust and revisit what our cut points are.
This is Martin, if I can add something. I think for Listeria monocytogenes, the 5 SNP cutoff seems to work pretty well too, and is a pretty comprehensive paper that sort of did a good size data analysis to support that as a cutoff for Listeria too.
Yeah, and this is Matt at CDC. I mean, I think too, it's it's important to sort of distinguish, thresholds that you would use to detect clusters versus, how you would think about, constructing a case definition in an outbreak investigation. And I think Carlota alluded to this in her talk, that, we always have to continue to evaluate the epidemiologic data, look at the whole genome sequence data that comes in, and potentially adjust that definition. So 5 might be really, really good to tell you those folks are definitely linked to a common source and we need to figure it out. But once you kind of figure out what that common source is, you may need to expand that definition because, it may be that 10 or 15 is more relevant. And we've certainly seen, outbreaks that have exceeded that 5 SNP threshold, where there is still very, very good concordance, I think, between the epidemiologic data and the sequencing data.
Matt, I'm really glad that you said that. That is a super important point that maybe I didn't emphasize enough. There is, I think, a real difference on using whole genome sequencing for an outbreak investigation when you're already started out, you already have your, whatever, you're looking at your outbreak, and now you're going to use sequencing to refine your case definition, versus in surveillance where things are coming in and you're trying to decide what to investigate. And then picking that cut point is sort of an artificial decision that we made based on our retrospective study, which made sense. We could have made it even narrower. We could just say we're only going to look at things that are 0 to 3. But we thought 5 would catch miss real outbreaks. But yeah, so anyway, so I think that's a really important point, that that there's almost like a little different way to apply sequencing depending on what the epi need is. All right, the next question is from Chelsea Nichols. Hi, Chelsea. The NCBI database generates dendrograms for uploaded sequences and provides information on SNP differences. Has anyone been able to use the basic data from the NCBI database to help identify clusters?
Yeah, this is Angie in Minnesota. We can access the trees from NCBI. Often I don't need to, because we have trees from either CDC or in New York, or that we've created internally. It does seem like all the trees that we get from our external partners or create internally or on NCBI all really give about the same answer. The SNP differences aren't always exactly the same, but they generally are kind of proportional. They're very similar and give kind of the same answer to what is clustering together and what isn't related.
Yeah, and this is Matt at CDC. I think one of the nice things about NCBI is, you know, not in all applications of sequencing, you're not always looking, you know, at all of the isolates at once. So sometimes we're investigating an outbreak and we're requesting sequencing, you know, based on a specific PFGE pattern. And so that means that we can sometimes miss cases that might have different PFGE patterns that could be highly related. And so my understanding, at least, is these tools at NCBI can give you a chance, much in the way I think that Tennessee or Minnesota are sort of creating these large trees of all the SE that's been sequenced. You can look at a large group of isolates that have been sequenced and sort of see which ones are related to one another, rather than sort of making that specific ask for further subtyping. So it's another way to look at the data, I think, to help ensure that you're really getting your arms around all the isolates that might potentially be related to an outbreak.
Okay, if anyone else has any questions, everyone's basically muted, as that's how the system works. So if you can type them into the Q&A, which should be on the bottom of your screen, or you can also use chat if you can't find the Q&A. Then that will help us to answer maybe one or two more questions.
Well, if you don't have questions or you're too shy to ask in a forum like this, or somebody else has control of your keyboard so you can't type your question, feel free to call any of us and we will gladly chat with you about any of this.
Okay, seeing that no other questions come in, there's one more, Art Liang.
So Art asks, what is the definition of an outbreak now? It is the same definition that we've always used. It has not changed it at all. Matt, maybe you can answer that question.
Yeah, I mean, I think that's that's like a science philosophy question in some ways. I mean, I think a lot of times we talked about an outbreak being an increase over baseline, over what we expect. That's a very PFGE way, I think, of looking at an outbreak, right? We have what we would expect, and is there 3 standard deviations above what we've seen, and that's an outbreak. But I think the other way
I have to jump in. That is a very CDC definition, but go ahead.
Sure, no, but I think the second definition, the way to think about it is, you know, any set of illnesses that are linked to a common source. And I think that sequencing, I think, is helping us tie together those illnesses that are linked to a common source. So they may not be, you know, more than we expect, but I think if we have epidemiologic and sequencing evidence to say that, you know, 2 or more people got sick from the same thing, I think that's an outbreak. I mean, I do think we get to a point where outbreaks start to get so small that it really bleeds into what's sporadic illness versus an outbreak. And I think that's probably more of like a philosophical question.
Right, and at the state level, I mean, the simplest definition is, like Matt said, just 2 or more cases with a common source, common source for their illness. So that hasn't changed. The difference is just the size of the outbreaks will be a lot smaller. Well, and I don't see any additional questions. So thank you everybody who dialed in and listened to this webinar, and thank you all who sent questions, and hopefully this was helpful. Matt and Steffany, do you have anything to add?
No, thanks everyone for listening.
Yeah, thanks so much.
All right, this concludes the session. Bye, thank you.